For Checkup 13 every month, we look at a different area of emphasis. And this month, for the month of December, we're looking at breast cancer detection, getting the 3D mammogram, and what about the MRI? Our conversation with Dr. Christina Kim. Dr. Kim, let's just kind of start off right at the top. Who needs to come in for a mammogram and how often? What are the recommendations right now?
The current recommendations for breast screening is to come in for an annual screening mammogram beginning at the age of 40. And these are for average risk women that do not have any significant risk factors for breast cancer. Women that actually have risk factors for breast cancers, for example, family history, I think those women may need to start a little bit sooner, and that would be dependent upon what their risk assessment is.
Right.
Yeah.
And we know there are so many things that can come between a woman wanting to get in for a mammogram and it actually happening. And one of those concerns is about whether or not things are covered. So when you have an issue with a family history, what is your recommendation for people to get in before 40?
So if there's a family history of breast cancer, I think the first thing that can be done is to talk with their physicians and to get an idea of what their risk is, and then from there they can be referred on to some specialists if they have a significant family history or concerns. When we, as specialists, see these patients in the office for the first time, we take a very thorough family history. Their gynecologic and hormonal history is very important. So there are all these risk factors: alcohol history, obesity, weight loss, those kinds of factors. And so based on all of that, then we can come up with a risk score that would help us determine how often and frequently they need to be examined and screened.
What are you seeing now as it relates to diagnosis of breast cancer in women based on their age?
So we are seeing more and more younger women diagnosed with breast cancer coming in, and we see that in the clinic all the time. And there are women coming in their 30s and 40s with breast cancer. The exact cause of that is still a little bit unclear, but I think there are some risk factors that are associated with younger women getting breast cancer. There are some things that we know are relevant for breast cancer risk, such as hormonal history, and we know women are giving birth to children at a later age or not having children. That can be a factor. Alcohol intake and the amount of alcohol intake can be a factor. We also know that body mass index or obesity and being overweight is a huge risk factor for breast cancer. So we're aware of these potential influences for breast cancer. The exact cause is unknown, but we are definitely seeing more and more in younger women.
Yeah. What is the gold standard for detection of breast cancer?
The gold standard still remains in the United States to be screening mammograms. We are performing 2D mammograms in addition to 3D mammograms, which is the tomography, and that adds to the accuracy and the early detection of cancer, especially in women that have slightly denser breasts, so that the addition of the 3D tomography is very beneficial for that. And so I think overall we're performing the 2D, 3D mammograms as a gold standard for mass screening, so annual screening mammogram.
This is one of those situations where early detection definitely improves outcomes. What is the unfortunate scenario that you see present that you wish that you could get the word out to not have that happen in your practice?
So we do see, women who are not willing to undergo a screening mammogram or even present for a clinical breast examination. I think those are both very important and they go hand in hand. And so then less and less, but we do still see patients that are coming in with very locally advanced breast cancers, the ones that are large in size, that are palpable. Sometimes if it's really severe, then we can see cancers that are eroding and ulcerating, and that you don't want to see, especially in this, in 2025 when we have all this technology available to us where we can do the early screening. there's a lot of knowledge behind doing prevention. I think it's very unfortunate when we see a patient like that who has had no access to care or no access to screening mammograms or not even having an awareness of it, and then they come in years later with a large tumor. So that's definitely an unfortunate situation that I know we can avoid.
And the incidence rate now remains 1 in 8 women in this country?
Yes, that's correct.
Yes. So what is the big thing that you have found that does inspire women to make their health a priority, to come in, to stay regular? What seems to work?
I think word of mouth is very important. I think when one person comes in, such as Michelle's case, and you know that the cancer is completely curable and we detect things very early and patients do well, the survivors that we have, you know, hundreds of thousands of survivors that are out there, I think that encourages women to come in and start their screening earlier. Yes. And I think there's a lot of media and a lot of attention to online now where you can get access and gain access that way.
We've been talking about the screening mammogram, but there's other technology that is a key player in making a diagnosis. Let's talk about that.
So I think one of the newer technologies that we've been utilizing for a couple of years now is really the MRI screening that has really changed the landscape of how we do early detection. In addition to the mammogram, some women are eligible to have the adjunctive screening with an MRI, and these would be mainly women who have dense breasts, which tend to be younger women, or women that have a higher risk of breast cancer. So if their lifetime risk of breast cancer is greater than 20%, then we would recommend doing additional screening. The MRI is really detects things that perhaps a mammogram and an ultrasound would miss, and so especially if you have a young woman with a family history, that would be a clear indication for doing an additional imaging, and an MRI is typically very good at detecting very small cancers, even as small as 5 millimeters. And so I think that is another technology that is really available to us and women. So we are constantly counseling patients about the MRI and the utility of MRI screening.
Yeah, important conversation. All right, Dr. Kim, thank you so much.